are going to look at the Glanzmann's thrombasthenia. So to begin with some questions, first question is what is the defect is associated with this condition? The second question being what about the platelet aggregation test? How are the reports? So in this video we'll find the answers to these questions and learn in detail. So to begin with, firstly the Glanzmann's thrombasthenia, it is we're looking at the inheritance pattern. So the inheritance pattern, it is nothing but it is autosomal recessive. Then what does this defect lie on? The defect, if you see, it lies on the absence. There is an absence of the GP2B3A receptor. GP2B3A receptor. And now we look at the mechanism. So what is the mechanism of this? The mechanism is that there is a platelet. So there are platelets and it cannot aggregate. The platelets, it cannot aggregate as the GP2B as well as the 3A. So what this does is it normally binds fibrinogen. It normally binds to the fibrinogen. And forms bridges. Between the platelets. Then we look at what about the platelet count. So the platelet count here is normal. Then we move on to the platelet morphology. So how is the platelet morphology? So the platelet morphology is nothing but it is normal. Then we look at the bleeding time. The bleeding time is that it is prolonged. It is prolonged in this case. And then we move on to the platelet aggregation test. So the platelet aggregation test. So platelet aggregation test, it includes components such as the collagen. So it includes the components such as the collagen, it includes the ADP as well as the thrombin. So these are the components. So here it is abnormal. It is abnormal. Then we look at the restocitin, the restocitin aggregation test. So we have the restocitin aggregation test, and this is nothing but it is normal. That is the aggregation of platelets. Next we have the BWF, that's the von Willebrand factor, and this levels are normal. And then when we look at the PT-PTT, so PT-PTT levels, they are again normal. Then we move on to answering our questions. So the first question we asked was, what is the defect? So the defect is nothing but in case of the Glanzmann thrombasthenia, it is the absence. So there is absence of the GP2B and the 3A receptor. And next we move on to the platelet aggregation test. So we asked how is the platelet aggregation test. So this first we need to know it includes the collagen. It includes the collagen and then it also includes the ADP and the thrombin. So it includes these components. Then what are the results, findings? The finding is that it is abnormal. So to grow daily, please do subscribe.